let's talk about sleep apnea and people who basically sleep apnea, which is, they might snore, they might not snore. Most sleep apnea people snore, but not necessarily all snoring people have sleep apnea. And basically, people stop breathing here and there for a little while. It's not quite as widely known that dentists have quite a good solution for that. Something you are doing, Dr. Pakman. Tell us about it.
Yes, well, what I always advise my patients when we do our health history and we talk to them whether they have a sleep apnea or a snoring problem, we want them first to be evaluated by their physician to see that there's anything more serious to their apnea than just a snoring problem. Once we've determined that, we have several devices, dental devices that we have that really act to reposition either the lower jaw or the tongue during sleep, and which really is quite effective to curing that snoring and sometimes the sleep apnea.
Because when a person, tell us a little bit what happens if a person, thinks that sleep apnea and here and there a little snoring, fine, it may bother my wife, but she's used to it by now, or vice versa. And but this stopping to breathe, which really lasts usually only seconds, maybe half a minute, whatever. But tell us a little bit of the impact of life that has if that isn't handled.
Well, most of the studies have shown that people that have severe sleep apnea or even mild to moderate sleep apnea are actually losing the best part of their sleep at night. The REM sleep is disturbed. Once the brain senses that the organism isn't breathing, it puts a lot of stress on the cardiovascular system. So what we find that people that have sleep apnea and that do a lot of snoring never really get a good night's sleep. There's constant fatigue and tiring. And when this goes on chronically, it can absolutely affect your immune system, and that can lead to other problems. So it's quite a serious problem.
Yeah, it looks like. I mean, and that doesn't even put into calculation, I guess, the oxygen deprivation the person has, which is probably because why the immune system gets damaged. But
exactly,
could there be brain damage, slight, just kind of get a little slower and
there absolutely has been. There have been neurological studies that do show that people with severe apnea do have a diminished brain function. They're not sure that it's a causal relationship, but it certainly seems to most of the researchers that the oxygen deprivation cannot help the brain at all. So
okay, and there is, however, instruments out there, whatever you call those things, which are, basically compressed air, slightly and even more oxygen heavy, gets, person puts a mask on it, it gets pushed in it. And those seems to be working very, very well, except many people apparently can't stand it while sleeping. They tear it off, because they kind of need to sleep a little bit like a numb. Tell us about it and how then the Europe life fits in and is more easy to digest for some people.
Right. Well, yeah, you hit the nail right on the head. These devices, the nose pieces and the forced oxygen and air that's being used are extremely effective. However, you have to wear it for it to be effective. And I've heard countless stories of non-compliance with these devices. And so we in dentistry have come up with some other devices that are much, much less obtrusive. They're little mouth devices that, as I said, reposition the lower jaw or the tongue and can really help with that situation.
Wonderful.
Much less invasive, much easier for the patient to comply with.
Well, a person whom I know still, about, a decade ago almost, I think. He's a sports guy and he's teaching sport and all that. So I asked him, what's the best exercise? And I was expecting something like swimming, bicycling or whatever. The sports we read in the paper to be good. And he looked at me and says, Helmut, the best exercise will be the one you're doing.
That's exactly right. Exactly right. Yeah.
The one you're able and willing to do.
Right.
And that makes lots of sense. So if this, as you said, those forced air machines are very, very, very good, but if you don't use them, it don't do you any good.
No, it doesn't do you any good. You're exactly right.
Right. Good. Well, wonderful. So it's quite amazing. It always amazes me, how many areas of life a dentist really helps out with. It's just amazing how our mouth is linked to, we talk
everything.
About, right now about, basically getting a good rest sleep. Then that also is happening by people who have too many missing teeth and their jaws get misaligned. They have neck pain, back pain, maybe headaches,
right.
And of course don't sleep so well. Then there's the people who lose teeth and because of it lose the jawbone and it shrinks, and because of it I start looking a little bit like that. They start looking like an old little witch. So you're basically a plastic surgeon for that much right away,
Right.
Then we have the gum disease thing where people who have gum disease, they're infecting their body minute by minute. They're dripping poison into their body on a minute basis. Their immune system crashes. They can get the flu. They can get premature babies. So it's amazing how many things really, get fixed and handled by the mouth. Most of us just think of having a nice smile, which is good.
Right.
Which is,
right. Of course.
The Julia Robertsons of this world, the Tom Cruises of the world, they have $1 million smile. It's true.
Right.
Right. But there's all those other aspects, which is
exactly
quite phenomenal.
Well, that's true. Everything is really interconnected with our oral cavity, and there's some really serious things that are coming down the pipe, as I think we discussed before, relating periodontal and gum disease to cardiovascular disease. So there are a lot of connections.
Right. Well, interesting talking to you, Dr. Pakman, and very informative. Thanks a lot.
You're welcome. Thank you.